Mrs. Leahy, unfortunately, the x-ray shows that you fractured your hip. Also, I am afraid to inform you that you have osteoporosis along with your osteoarthritis. I will be writing you a prescription to help you with some of your symptoms, okay?
Okay.
Hello, Miss Leahy.
Hi.
I'm Tree. I'm gonna be your nurse today. I am here to answer any question that you have.
What is osteoporosis and arthritis? Why do I have it? Did I do something wrong?
So as you age, your bone become weak and brittle, which is what causes osteoporosis. It is common in older women, and the weakness in your bone can be attributed to insufficient amount of vitamin D and calcium. And some action you can take to slow the process of bone loss are partaking in weight-bearing exercises. Do you have any other questions?
Oh, I'm too old to lift weights. What about her arthritis?
For arthritis, you can for weight-bearing activity, it can be simple, just like walking around the block or using resistant bands, which will decrease your chances of developing chronic joint symptoms due to arthritis. So if you walk, you can reduce the chance of you can reduce the symptom of your arthritis too.
Okay.
This exercise can also improve your posture, which will decrease your chances of falling and breaking your bones, which is really a really big problem, right? You want to make sure that you exercise at least 3 times, so 3 days a week, for at least 30 minutes at a time. So I can see that in your chart that you do not normally consume alcohol, but your smoking habit can increase the bone loss. So are you interested in information to help you stop smoking?
Of course. I'm not ready to die.
Good, good. Also, it is important that you experience, if you experience any pain for an extended amount of time in your joint, it is important to come back and see the doctor. All right?
I suppose this means I'm officially an old woman.
Do I need to worry about these diseases because she has them?
You do have a greater risk of developing osteoporosis because of heredity, but it does not guarantee that you will get it. You can make sure to obtain the daily recommended amount of calcium and vitamin D to maintain your bone density. Perform 30 minutes of weight-bearing activity a day, so you can walk with her to keep her company, and you can both reduce the risk. And you can lift weight and make sure to do this activity at least 3 times a week. Furthermore, you should stay away from smoking and excessive amount of alcohol, which can also prevent osteoporosis. And if you use birth control, if you use birth control pill, it can also increase your chances of developing the disease.
I'm definitely not ready for a baby.
So other form of birth control are available though, but they are not. We're not sure that they have any effect on osteoporosis. However, you can do bone density test to determine your current rate of your bone, which can also diagnose your osteoporosis before you break any bone. And this test may be of great importance after you turn 30, because bone density tends to begin decreasing after that age.
What about for the arthritis?
Osteoarthritis is not hereditary, so the risk factor for that type of arthritis are increased age and being overweight. So you want to make sure that you eat healthy along with exercise that we talked about earlier to maintain a healthy weight.
It is good to know that I have some control over whether or not I develop these conditions. Is there any other information I need to know about bone health while I'm here?
Well, so I can see that you have a heavy back on one of your shoulder. you should make sure to alternate what shoulder you carry your bag on. If you continue to carry it on one shoulder, the uneven weight distribution can lead to functional scoliosis, which is the lateral curvature of the spine. You can also get screened for this as well if you are concerned. So, are there any questions that I can answer for you, ladies?
I don't think I can handle any more information. Thank you.
I will begin my exercises right away. Thank you so much for answering all my questions. I was so scared and confused when the doctor walked out.
All right. Hope I help you with. I help you with answering your question. So I'll be back in a little bit to check up on you. If you need anything at all, or have any questions, just put your call live button. Okay.
Thank you.
Okay, thank
All right.
you.
See you later.